So greetings. Welcome to today's Youth-Centered Care webinar. I'm really glad you're here with us. Today we're focused on how we as public health folks can help our clinical colleagues train their healthcare teams when resources and time are limited, something we all know well. Next slide, please. My name is Kristen Teipel, and I direct the State Adolescent Health Resource Center at the University of Minnesota, and I manage a youth-centered care learning community, all which are part of the Adolescent and Young Adult Health National Resource Center. Our focus today is on an important component of youth-centered care, ensuring that the clinicians and staff who care for youth have the skills and knowledge and practices that truly meet young people where they are and meet their needs. Or, as my 17-year-old daughter, Maddie, says, provide me the space and the experience where I'll open up and explore things that get in my way. So we're going to learn about a new training resource called SPARCS, and a brilliant approach to training that's brought to us by our webinar co-sponsors from the Adolescent Health Initiative at the University of Michigan. Next slide, please. So welcome to my colleagues, Lauren Rinaldi and Eleanor Wagner from the Adolescent Health Initiative, who are going to share their SPARCS with us. Lauren directs the Adolescent Health Initiative, where she's been since 2013. She comes to us with a master's in public health from the University of Michigan and a Bachelor of Arts in Psychology and Education from the Washington University in St. Louis. She brings with her rich experiences working with both federally qualified health centers and community-based organizations in both Illinois and Michigan, and her previous work as the Vice President of the Michigan chapter for the Society of Adolescent Health and Medicine. Ellen is the Adolescent Health Initiative's Project Director, where she's been since 2016. She comes to us with a master's in both public health from the Columbia University Mailman School of Public Health and basic medical sciences at the New York Medical College, and undergraduate work in politics from the University of California in Santa Cruz. Her rich experiences have been in New York City, leading patient-centered outcome improvement projects in a variety of settings, including a large health and human services agency, public hospitals, and academic medical centers. Nice. So thanks for sharing with us today, Ellen and Lauren.
Great, thank you. Hi, everyone. This is Lauren Rinaldi.
Hi.
Good. And we want to say thanks for having you join us today in this type of training of trainers on how to facilitate a SPARC. So the Adolescent Health Initiative is based out of the University of Michigan, but we work with a national audience of providers and healthcare professionals to provide training, technical assistance, and coaching to improve adolescent-centered care and also improve adolescent health outcomes. So here's what you can expect from today's training. First, we're going to share what a SPARC is and then demonstrate one for you. Then we're going to briefly review the SPARC model and dive into how you can deliver a SPARC at your organization. Let's go ahead and get started. AHI developed SPARCs to meet the needs of health centers and youth-serving organizations that have limited time for staff training, but who are interested in improving the youth-friendliness of their organization. So we currently have a menu of 8 SPARC trainings, and they're available to you to use and download directly from our website. And each SPARC comes in a version designed for clinical or a non-clinical audience so that they can be facilitated in your own health center or organization, shared with community partners, or used for partnership building professional development opportunities. So today we're going to show you an example of a clinical SPARC. So what exactly is a SPARC? SPARCs are mini trainings that can be delivered in about 15 to 30 minutes and are meant to spark reflection, conversation, and behavior change. They include ready-made PowerPoint presentations, scripts, and accompanying materials so that they're ready to be used and presented with very little preparation. We want to make them as easy for you to use as possible. They're typically facilitated by 1 or 2 individuals within an organization for the rest of the organization's staff. And since SPARCs are so short in time, they're accompanied by what we call sparklers, which are short activities that can be posted in your organization throughout the month to keep that particular topic on everyone's mind. So the sparklers might be case scenarios, youth quotes, or quizzes. So now we're going to run through a Spark so you can see how it works. This is a Spark on being youth-friendly. For this demonstration, Ellen is going to be in the role of facilitator, and I want us all to imagine that we're participating together at a staff meeting. So please use your chat feature to participate in the brief activities as if you were a participant. So a final note, the Spark comes with a script, which Ellen is mostly going to follow so that you can get a feel for it, but she's also going to occasionally provide you with some prompts or suggestions about how you might facilitate this on your own. So now I'm going to turn it over to Ellen.
Great, thank you. So again, we are going to all pretend and envision that we're in a room together, that we are participating in a monthly or however often staff meeting that your team comes together. So just keep that in mind as we go through this. So hello everyone. It's so great to see our whole team here at the meeting this morning. As a reminder, I'm Ellen, your grants manager. So for the next item on our agenda today, we're going to do a 15-minute mini training, also called a Spark, to look at ways we can best meet the needs of the youth we serve. This Spark is on being youth-friendly. To help us think back to our own experiences as youth, we're going to do a quick activity. So normally during a Spark, you would ask participants to turn to the people around them and ask them to fill in the squares on a handout that has the same questions that you see here on the screen by completing the sentences. But for the purpose of the webinar, we're going to do it a little bit differently. So take a moment and chat in your responses to some of these questions. So the first one, what is your response to the question about what was important to you when you were a teen? So take a minute and chat something in. Friends, yes, I see a couple friends answers. Definitely friends. Being liked. Grades, activities, belongings, being good, being liked. Fitting in, having fun. Yep, these are all great responses. Feeling understood.
It's like driving in freedom, I like that.
Yeah, driving in freedom, not being embarrassed. This question is so interesting. I'm always struck by this one because I think what was important to me when I was a teen, these also feel like things that are important to me now. So just an interesting observation. Okay, let's do another question. What is hard about working with teens? So chat in some responses about what is hard about working with teens. Getting them engaged. Power dynamics, that's a really interesting one to think about. Yep, great responses. Busy schedules, gaining their trust, keeping them interested, remembering their teens, that's a really important one to think about too. Gaining trust. Great, great responses. Okay, let's do one more. What is the best thing about working with teens? Honesty, authentic, honesty again. So many ideas, yep. Energy, I saw a few high energies. Wow, you guys have a lot of great things that you, the chat window is flying by. You have so many thoughts about what is so great about working with teens. Clearly we're a group of people that cares about working with young people. They're sponges and so intelligent. I love that one, yep. So the purpose of this activity was to help us think back to our own experiences as young people and to remind ourselves that it might take special effort for us to meet their needs as they engage with staff across our organization. Let's take a minute to hear from teens directly in this 3-minute video about how they want to be involved in their healthcare. The teens in the video are from the Adolescent Health Initiative's Teen Advisory Council. As you watch, keep these questions in mind. What might happen when youth don't feel comfortable accessing services, and what might happen when they do feel comfortable? So let's play the video.
Hi, I'm Julie.
I'm Brandon.
I'm Clara.
And I'm Felipe.
We're here to talk about some ways that health centers can meet the needs of teens and young adults through things like physical space, policies, and personal interactions.
There are tons of ways to help teens feel welcome. Here are some of our ideas.
For some of us, getting to appointments is kind of challenging.
Having bike racks outside can make it easier for when we don't have transportation.
Posting hours outside your clinic is important, and make sure you have times after school hours so students can get there too.
It can really help some of us with unpredictable schedules if you accept walk-ins.
And if we happen to run late for an appointment, please try not to make us feel like we've broken the law.
The more comfortable we feel, the more we'll want to come back, which will help us get better health care.
Your waiting room matters. It's our first impression and a place where your teen patients will have to, well, wait, but hopefully not too long.
And waiting means sitting, so why not have comfortable options for all shapes, sizes, and ages?
I know doctors' offices are for little kids, but they're for teens too.
Why not show a diversity of styles and types of artwork?
And maybe even feature some pieces by local teen artists.
I'd like that.
Real plans are great too, but if they don't look taken care of, it makes me feel like I might not be either.
Magazines are standard in any waiting room, but why not have some that are geared to teens, like 17 or Electronic Gaming Monthly?
No, I want Mad Magazine or J14. Or Wi-Fi. I'd like the Wi-Fi password posted even better.
Hey, what about magazines in other languages? Servicios de traducción en otros idiomas sería aún mejor.
Yeah, also show that the space is safe and inclusive of LGBTQ+ youth, such as the rainbow sticker on the door. Teens can have pretty different interests, but one thing that matters to all of us is privacy.
Definitely. Having some kind of dividers at the reception counter can help keep us comfortable when we share private information.
I've even been at a place that had a white noise machine to make it hard to overhear.
As much as we love the reception area, we're really here to get into the camera.
Of course we expect it to be clean and professional, so what matters most is our interaction with our doctor.
This means we're getting good eye contact, non-judgmental listening, and welcoming body language.
Having a confidentiality policy clearly posted in the room really helps us feel comfortable being honest.
And so it is during check-in throughout our appointment to make sure we're on the same page.
Remember, not all situations are the same, and not all teams are the same. When in doubt, ask us.
So thinking about the video and the perspectives of youth, what might happen when they don't feel comfortable with their healthcare experience? So chat in some thoughts on that. They won't come back? Yeah, they won't come back. They're not going to feel like it's a space for them or want to come back and trust the people that are there to serve them. And what might happen when they do feel comfortable? Yes, they'll come back, and even better, they'll tell their friends to come back. They'll be honest. They'll take better charge of their health. Great responses. So while teens are in this transitional stage of life, we know from research that teen brains are at a critical point of development. The part of the brain that controls executive functioning, which includes judgment and cause and effect, is not fully developed until the mid-20s. When teens make decisions that seem questionable, it's helpful to remember that this can be developmentally appropriate, even if it's frustrating for us to see. A great example of how teen brain development is unique to this age has to do with risk-taking. People of all ages take risks, but it's at its peak during adolescence and can be good for both good and bad. There are emotional risks, social risks, and physical risks that all help adolescents to build their identity. But some risks can be unsafe. The CDC reports that 3 out of 4 adolescent deaths, diseases, and disabilities are a direct result of risky behaviors. This is disproportionately high compared to other age groups. This also means that there are opportunities for prevention, and we could change the outcome for a teen through good screening and counseling. So, if their behaviors are developmentally appropriate, as challenging as they may be, what can we as adults do to help them along the way, and we as healthcare professionals do to be truly patient-centered? One of our main goals with becoming more youth-friendly is to look at how we interact with young people and how we make them feel welcome. There are lots of ways that health centers can be welcoming to young people, and we have 8 of those behaviors listed here on the slide. So here's another modification that you'll see would be a little bit different if you were doing this Spark in person. Normally when you're leading this Spark in person, this information that you see on the slide would be on a handout, on the same handout as the game that we played before for participants to reference, and then there would be several slides that we're going to go over now that have scenarios that you'll read and would use this information in tandem. But since we're doing it a little bit different for the webinar, what we're going to do is have the youth-friendly behaviors here on the screen instead of the handout, and I'm going to read the scenarios. So for the next few minutes, we're going to read the scenarios in which youth-friendly behaviors and decide which youth-friendly behavior the scenario relates to. There's no right or wrong answer, and for some there could be multiple answers. Okay, here's the first one. Studies have shown that providers often don't counsel their adolescent patients with chronic illness on reproductive and sexual health, even though adolescents with chronic illness participate in sexual activity at similar rates to their peers without chronic illness. Which youth-friendly behavior does this relate to? So go ahead and chat in which one you think that corresponds to. Keep in mind that this is obviously an example of what not to do. Yep. I see 7, 2, 8. I see several 2s. Yep. Provides and or supports fair treatment and equal opportunity for all adolescent patients. Agreed. And yeah, several of these correspond to more than one of these answers. So there's no right or wrong answer. Great. Let's do another scenario. Here's the quote. My mom talks to her and she talks to my mom. I'm just here. I'm just there to get poked. This is a quote from Luis at age 16 and is another example of a not so adolescent friendly interaction. Which one does this relate to? Three, yeah, listens to and objectively considers what adolescent patients have to say. I see several other answers, 1, 4, I think those all also correspond. Okay, another one. The following story is from Ray at age 23. When I explained to the staff that I didn't have insurance, she was like, oh, there's this program and there's this resource and you can get help here, or you can go this route. And I was just like, whoa, no one ever told me that before. Otherwise, I felt doomed, and she kind of gave me hope. I've gone to other really nice places, and same thing. They were just positive about it, like, that's no big deal. We can work with that, and there's options. Whenever I was given options and I didn't feel hopeless, it was a good experience. So which youth-friendly behavior is this an example of? I see a resounding 6. Yep, 2 as well. So 6 is patiently helps adolescents navigate referrals and any other systems that may be challenging. All right, one more. You have to explain that nothing bad is going to happen if I'm honest. What do you think Ciara is referring to when she says nothing bad is going to happen? Which youth-friendly behavior does this relate to? Seeing a lot of 1s, yep, accurately discusses and applies confidentiality, consent laws with all adolescent patients. 8 as well. And that's the end of today's Sparks. Thank you everybody for giving me some time on today's agenda. It was so nice to have our whole team engage in this discussion. To keep the conversation going over the next month, I'm going to share sparklers or case scenarios that relate to being youth-friendly. I'm going to post them around the office in places that we can all easily see them. When you see a sparkler, take a moment to read the scenario and think through the questions listed on the page. Thanks for your participation, everybody.
Okay, thanks, Ellen, and thanks, everybody, for chiming in as participants for the Spark. We're going to ask you a few more times throughout the rest of our time here to kind of chat in some responses, so looking forward to your engagement there. And now that we've modeled a Spark for you, how to use the PowerPoints and the script, we're going to spend a few minutes diving into the Spark model. So all Sparks follow the same outline. The hook is what emotionally draws someone into the topic. Key concepts introduce the content, and the application and sparklers give participants ideas on how to put what they've learned into action. So for the Spark we just did, the hook was the teen years activity. The video introduced key concepts, and discussing the behaviors and how they apply to practice was the application portion. So now that you know what a Spark is, let's talk about how to effectively deliver one in your organization. So the good thing is you do not need to be a seasoned public speaker or content expert to deliver a Spark. What you need to be is a facilitator. So using the chat feature, tell me what you think are some qualities of an effective facilitator. And give everyone a moment to respond. Eye contact, asking open-ended questions, listening, yep, time management, right? Engaging, knowledgeable, respectful, making a connection, drawing each participant into the discussion, active listening, affirming participation. Yep, these are great responses. Kind and interactive, giving everyone a chance to talk, effective word choices, fun, I agree, definitely you want some fun in there, knowledgeable. Give everyone just one more second if anyone else has anything to contribute. But yeah, those were all great, great suggestions. So other things, you know, making sure the timeliness, watching the schedule, adapting to the group needs, as people were saying, being a clear communicator, being prepared, I think is really important. I think that a sense of humor can often play well in a presentation. Making sure you can tell that somebody maybe cares about the topic or cares about the participants and is really encouraging. So as you can see on this slide, to facilitate means to make easier, meaning we create a safe and supportive space for people to work together and learn by providing a structure for learning. So a facilitator is a person who effectively and efficiently guides without directing, brings about change without disruption, and assists people in groups in constructing their own learning. So Sparks are designed to be delivered by a facilitator rather than a presenter. They're supposed to be conversational and spark dialogue rather than being focused on transferring knowledge from the presenter to the audience. So let's keep this in mind as we continue. So we're going to spend a few minutes thinking about 5 adult learning principles. And those are that adult learners need to know what they need to know. Adult learners have a deep need to be self-directing. We have a deep reservoir of experience that is a rich resource for learning, both for themselves and for others. Adult learners become motivated to learn something when they experience a need to learn it in order to cope with real-life needs, interests, or problems. And adult learners attach more meaning to learnings they gain from experience than they acquire passively. They prefer to be problem-solving over subject-centered learning. So think for a moment about yourself, and using the chat feature, are there any of these that really resonate with you? And so you can type in the number of the ones you feel most connected to as an adult learner yourself. Number 5, 2, Yep, 5 coming up, 5s and 2s. I see 3. Yep, lots of them. I think so many of these probably apply to us. Number 4, you get motivated because it relates to something maybe that's timely in your life. Yep, I definitely see myself in a lot of these as well. So thank you for contributing. So when facilitating a Spark, think of which of these principles might also resonate with your staff and how you can use these principles to effectively provide professional development opportunities. So some examples might include providing background or rationale on the topic, including interactive conversation prompts, or having opportunities for participants to share their own experience and expertise. So when you download a Spark from AHI's website, here's what you'll get. You're going to receive the PowerPoint slides, the facilitator script, the participant handouts, and the sparklers, which are the follow-up activities that can be shared throughout the month. So this is an example of the script that Ellen was using today to facilitate your Spark. So on this slide here, we show a portion of it, and at the top you'll see what supplies are needed for the Spark. So this often is going to include a projector, laptop, speakers, copies of the handouts that go along with the Spark, just to make sure that you're prepared before presenting. We always encourage people, test your audio, test your visual, test the video before you do your Spark presentation. You'll see that the script also clearly notifies you when to switch slides with the computer icon and the slide title. And as we said, Spark scripts are already written sort of in a conversational tone. Occasionally, though, you'll see some blue text providing the facilitator with some instructions or prompting you if it's maybe an opportunity for you to share a personal story or a patient interaction. And the goal of the script is to make it as easy as possible, requiring very little preparation time on your part. So now that you know the background for Sparks and you've seen one in action, what's next? So first, I would encourage you to take a look at all of the Spark topics that are available on AHI's website to see what might be a good fit for your community. So in addition to the Being Youth-Friendly Spark that you participated in today, AHI has created Sparks on adolescent brain development, being an askable adult, strengths-based approaches to adolescent sexual health, non-judgmental communication bias, and some other topics as well. And we're always in the process of creating new Sparks, so if there's one that you don't see that you're interested in, send us an email, and it might be something that's in the works, or it might be something we might be able to put together. So the next thing I would suggest is think about your setting. So Sparks can be facilitated in a health center with an entire practice team, which means everyone from the front desk staff, medical assistants, social workers, physicians, security guards, so on. Anyone who interacts with patients. Sparks can also be used for professional development opportunities with community partners. So you could share the format with them or offer to facilitate a Spark in their setting. And we've also helped organizations host Spark Train the Trainer sessions for partners in their community. If a conference is coming up, are you thinking, so this is a chat question that came in. If a conference is coming up, are you thinking that we could do a training on Spark? So yeah, Carol, feel free to reach out to us. We could help you put something together. But yes, Sparks are intended to be used. And so if there's a format or a platform that you have coming up, we'd be happy to talk to you about that. So additionally, with anyone, just connect with us, after this webinar if you have questions or ideas about how Sparks could work in your setting. And then the final step, I would say, is schedule one and see how it goes. And let us know. We're excited to hear from people across the country about their experience. Just recently, we got some feedback from the Alabama campaign to prevent teen pregnancy, where they messaged us and said, I found your Sparks on your website last night, and I did them in my staff meeting this morning. And we're like, great, that's how they are meant to be used, and that's how easy we hope they are for people to use. So we wanted to take a quick moment to tell you about other resources that AHI has developed, all towards the goal of improving adolescent-centered care. So we have a number of tools available for health centers to assess the adolescent friendliness of their sites. And these range from simple checklists or youth-led assessment processes to more in-depth quality improvement initiatives to help health centers become certified adolescent-centered environments. Starter guides are mini toolkits that offer concrete, actionable steps to improve adolescent care. So we have 9 guides available currently, including topics such as improving well child visit rates, increasing chlamydia screening rates or HPV vaccination, establishing or enhancing collaborations between primary care providers and school-based health centers, as well as a number of other topics. For health centers, we've also created a number of other resources that help providers and staff understand principles of adolescent-centered care, as well as posters that provide visual cues to patients that adolescents are a welcome and valued population. And these resources have all been developed sort of in collaboration with our Youth Advisory Council. I'm going to pause for a moment and look at this chat question. Oh, great, thanks for sharing Sparks. And then other Spark ideas for public health, share your resources widely, AAP chapters, yep. Is there a cost to this resource? So Spark starter guides, a lot of the videos and all the things that are on our website, these are all just free to download, free to use. We do have some more intensive quality improvement projects where we kind of work, where we consult with health centers, but the vast majority of everything I'm sharing here today is just on our website and ready for you to use. So in addition to the video you saw in today's Spark, AHI has created a number of youth-driven videos for providers, parents, and patients, including topics such as teen self-advocacy, being your own healthcare advocate, voices of transgender adolescents in healthcare, and a video for parents on transition called Take the First Step Out of the Exam Room. And again, these are all available on our site. And we hope that you'll take advantage of them. And then finally, as I just mentioned, AHI provides technical assistance, coaching, and consulting on a number of different topics. So if there's a need in your community, please feel free to reach out to us. And then lastly, I wanted to let everyone know that registration is now open for the 2018 Conference on Adolescent Health. So this is an annual event that draws physicians, nurses, social workers, researchers, students, and other public health professionals from across the country. And actually, we have an international audience as well. What I think is so great and unique about this event is that about half of the sessions of the conference are actually co-facilitated by youth collaborators, which provides real-time perspectives from youth on how providers and health professionals can improve adolescent-centered practices. So registration is open now. Early bird rates are available through March 9th. It's a really fun event, and we hope that you can join us April 23rd and 24th. Just click on this link here or go to our website to find out more information about the agenda and the amazing lineup of speakers that we have. So thanks so much for participating in today's training on how to facilitate a Spark. We're very excited to hear about how your first Spark goes at your organization. So like I said, feel free to reach out to us for additional support as you're preparing to facilitate a Spark. And we're going to open it up now to any additional questions that people might have. I'm also going to chat in my email address right now so that if people have follow-up questions after today, you can always go on our website and kind of get connected to our general email address. But here's my direct address in case you have any follow-up questions or want some clarity or additional resources. Okay. So sorry, but do you do follow-up assessments to look at training outcomes? Are you talking specifically about outcomes from the Spark? So it's not something that we include regularly as part of the downloadable materials, but we have done some just sort of Spark evaluation. So if there is, if you have an interest in doing an evaluation, sort of like a retrospective pre-post from people who participate, feel free to reach out. As we said before, the Spark is really, it's 15 to 30 minutes long, so you can kind of get a sense of how people felt about it and if it's going to prompt any kind of possible behavior change or practice change, but because they're not meant to be really in-depth training, we haven't done a lot of regular assessment for people who are facilitating them in their own settings. When we facilitate them with our cohorts of adolescent champion sites, then yes, we're doing kind of more structured evaluation. Okay, any other questions from today? Can you give us an example of a sparkler? Yes, so I don't have one that I can pull up right now. Ellen may be able to pull one up as I'm talking to you. But sometimes it will be like a case scenario that gets posted with a question or a prompt. It could be like a quiz for people to take, or even just a quote from youth just to put up in like a break room or on to sort of review at huddles. So I think everyone should be able to see now. Yep, so here are the sparklers for this spark that we shared today. So here we are, and it kind of gives these quotes from youth and a little bit more information, some statistics about youth risk behavior. And so again, these are things that you can just sort of post in your health center or in your organization to kind of keep people thinking about the topics throughout the month. We have a lot of sites that use Sparks as a series. So if you have a regular monthly staff meeting, they will include 15 to 20 minutes at each staff meeting to do a Spark. And then they'll put up those sparklers for the month. You can see Ellen just kind of scrolling through here. These are a few pages of things that you could post and switch out every week or every few weeks, just to sort of give you an example there. They're really just meant to kind of keep the conversation going. Any other questions for today? Okay, well, I think we will hand it back over to Kristen then to sort of wrap up. Thank you so much for your participation, and we hope to hear from you.
Thank you.
Great. Thank you, Ellen and Lauren. I really appreciate your time and the resources. And as I think everybody can see, taking a few minutes, even a lot of minutes, to go look at your website and find out more about all the resources you have to share is well worth your time. I also share that if you are working in public health and looking for some support in figuring out how to use Sparks to help your clinical folks use Sparks, please give the State Adolescent Health Resource Center a buzz. We're happy to talk with you. And you can get, I will stick in our web address here in a minute. Actually, Rena, can you possibly do that for me? A little bit technology challenge today. But thank you so much. We will be archiving this webinar, and you should be able to get a link to that really soon. And if you have clinical colleagues who you think might be interested, please share that we will be redoing this webinar on February 1st for the clinical clinician crowd. So thank you very much.